Before we close out our video today, do you have any additional information that you believe patients with cancer should know?
Certainly. I think the first thing is that I've seen a lot of people get very distressed when they've had a diagnosis of a clot in their cancer journey because they think, wow, this is a complication, you know, that's a terrible sign, things are not going well. This is so common in cancer that actually I see it as just a normal part of the cancer journey. So I would say don't read anything into it. This is normal. In the same way that you may feel nauseated with certain chemotherapies, you may lose hair with certain chemotherapies, you may get infection with certain chemotherapies, you may get a clot with certain chemotherapies. This is all normal. It's important to have information because when you are first diagnosed with the cancer, your mind is spinning. You're going through the shock of the diagnosis. You're wondering, what am I going to do? How am I going to tell my family? How am I going to manage? And you don't take all the information in. So sometimes you need to get information more than once. What I'd say is there's a couple of really good resources. First of all, there's an excellent video which I and colleagues were involved in making called Cancer, Clots and You. And that was made by Anticoagulation UK. It's on their website and it's also on the website of Thrombosis UK. So I think that has excellent resources and that video is really nice. It really explains things carefully. In fact, what we found in our clinical practice was that it meant that people were presenting sooner when they had symptoms of blood clots. Previously, it would take 9 days before someone would seek medical help if they had symptoms of a DVT or a PE. After using this video and putting it into our clinical practice, that number had reduced down to 3 days. So we reduced the rate or the speed at which people presented by 2/3. And I really believe that that saved lives. Also, the presence of that video as video cards in the chemotherapy suite, in outpatients, increased the awareness of staff as well. So I think they had a much lower threshold for questioning whether a patient had a clot. So we need to involve our healthcare professionals, but we also need to feel empowered ourselves to ask about clots because it's our bodies, it's our health, and therefore we have every right to make sure that if we have this normal part of the cancer journey, we need to pick it up and get adequate treatment for it.